Welcome to this video exploring familial atrial fibrillation, a heart condition with a significant genetic component. We'll delve into what causes it, how it affects the heart, and what can be done to manage and potentially prevent it. Familial atrial fibrillation, or AFib, isn't caused by typical risk factors like high blood pressure or heart valve issues, although those can still contribute. Instead, it's primarily driven by genetic mutations inherited from one or both parents. These mutations affect the heart's electrical system, making it susceptible to irregular heart rhythms. Specific genes implicated include, but are not limited to, genes encoding for ion channels, structural proteins, and transcription factors involved in cardiac function. The specific mutation and its effect can vary widely even within the same family. Normally, the heart's electrical signals travel in a coordinated way from the sinoatrial node, the heart's natural pacemaker, through the atria to the atrioventricular node, and then to the ventricles. This allows the heart chambers to contract in a synchronized manner. In familial AFib, the genetic mutations disrupt these electrical pathways. The atria begin to fire electrical signals rapidly and chaotically. This uncoordinated electrical activity causes the atria to quiver instead of contract effectively. This chaotic electrical activity prevents proper blood flow from the atria to the ventricles, and also leads to an irregular, and often rapid, heart rate. Familial atrial fibrillation accounts for a significant portion of early-onset atrial fibrillation cases, often defined as those appearing before age 60. The exact prevalence is difficult to pinpoint due to the challenges in identifying all affected families and the varying degrees of penetrance of the gene mutations. That means not everyone who inherits a faulty gene will actually develop AFib. However, studies estimate that up to 30% of individuals with early-onset AFib may have a familial predisposition. The true scope of the condition is likely still underestimated. The symptoms of familial AFib are similar to those of other types of AFib and can range from mild to severe. Some individuals may experience no symptoms at all, a condition known as asymptomatic AFib. When present, symptoms can include palpitations, which feel like a fluttering or racing heartbeat, shortness of breath, especially during activity, fatigue, lightheadedness or dizziness, chest pain or discomfort, and weakness. The frequency and severity of these symptoms can vary widely among affected individuals, even within the same family. Diagnosis typically begins with a physical examination and review of the patient's medical history, including a detailed family history of cardiac issues. An electrocardiogram, or ECG, is crucial for detecting the irregular heart rhythm characteristic of AFib. Holter monitors, which record the heart's electrical activity over a longer period, such as 24 hours or even weeks, can help capture intermittent episodes of AFib. Event recorders, which are activated by the patient when symptoms occur, can also be useful. Genetic testing is increasingly available and confirm the presence of specific mutations known to cause familial AFib. Genetic counseling can help interpret the results and understand the implications for other family members. While familial AFib doesn't have distinct types, in the same way some other conditions do, it's important to recognize the heterogeneity of the condition. Different genetic mutations can lead to varying clinical presentations, age of onset, and response to treatment. Some individuals may develop lone AFib, meaning AFib in the absence of other underlying heart conditions, while others may have AFib in combination with other cardiac abnormalities. The classification and categorization of familial AFib are evolving as our understanding of the underlying genetic mechanisms improves. The treatment for familial AFib is largely the same as for other forms of AFib, focusing on controlling the heart rate, preventing blood clots, and potentially restoring a normal heart rhythm. Medications include rate-controlling drugs, such as beta blockers or calcium channel blockers, to slow down the heart rate, antiarrhythmic drugs, such as amiodarone or flecainide, to maintain a normal rhythm, and anticoagulants, such as warfarin or direct oral anticoagulants, to reduce the risk of stroke. In some cases, catheter ablation, a procedure that uses radiofrequency energy to destroy the areas of the heart causing the abnormal electrical signals, may be recommended. A pacemaker may be implanted in rare cases where the heart rate becomes too slow. Currently, there's no definitive way to prevent familial AFib in individuals who inherit the predisposing genes. However, maintaining a healthy lifestyle can potentially mitigate the risk and severity of AFib episodes. This includes managing blood pressure and cholesterol levels, maintaining a healthy weight, avoiding excessive alcohol consumption and caffeine intake, quitting smoking, and managing stress. Regular check-ups with a cardiologist, especially for individuals with a family history of AFib, are crucial for early detection and management. The prognosis for individuals with familial AFib varies depending on the severity of the condition, the presence of other health issues, and the effectiveness of treatment. While AFib itself is not typically life-threatening, it can significantly increase the risk of stroke, heart failure, and other cardiovascular complications. With appropriate treatment and management, many individuals with familial AFib can live long and healthy lives. Recent research is focused on identifying novel genetic mutations associated with AFib and developing targeted therapies that address the underlying genetic defects. Gene therapy approaches are also being explored as potential future treatments for familial AFib. Furthermore, research into personalized medicine aims to tailor treatment strategies based on an individual's specific genetic profile and clinical characteristics.